We turn our focus tonight on the health sector in the FCT. Dr. Adedolapo Fashawe, Mandate Secretary on Health Services and Environment in the Federal Capital Territory Administration, joins us for a sit-down tonight as we examine the roles, the highs and the lows of the office she occupies. In 2023, Dr. Abubakar Tafida, the Secretary, Health and Human Services Secretariat, hinted that the administration requires about $22 billion to close the funding gap of primary health care. Where do things stand now? Health facilities targeted to serve about 1.5 million people are now overstretched to serve over the 6 million people in the FCT. How is her office dealing with this deficit? How functional are our primary health care centers, and are they functioning optimally? And then there are calls my guest has been making: health insurance, decarbonization, telemedicine, a 1.4% HIV prevalence rate. So much to unpack tonight on Dateline Abuja. Hello and welcome to Dateline Abuja. I'm Kayla Magwa. Let's begin with an update on the major stories this week from Nigeria's presidency. President Tinubu is on leave for 10 days in Europe after revoking major appointments and declaring that the year's revenue target has already been met. It's time for our Abuja wrap.
President Bola Tinubu has mourned the passing of Solomon Arase, the 18th Indigenous Inspector General of Police, who died on Sunday at 69. In a statement from the presidency, President Tinubu condoled the Nigerian police force and the family, friends and associates of the highly resourceful officer. Reflecting on Arase's laudable service to the country, President Tinubu remarks, Arase served the police force meritoriously from 1981 to 2016. During his career, he led tactical, operational and intelligence units, including the United Nations peacekeeping in Namibia, the Commissioner of Police in Akwa Ibom, and the principal staff officer to 3 IGPs. I pray for the peaceful repose of the soul of this dedicated security expert whose experience and contributions will be deeply missed by our nation. President Bola Tinubu has announced that Nigeria is not borrowing and has met its revenue target for the year. The President was speaking during a reception for members of the defunct Congress for Progressive Change, led by former Nasarawa State Governor, Senator Tanko Almakura. The delegation thanked the president for steering the country through challenging economic times and for honoring the memory of their late leader and mentor, former President Muhammadu Buhari. They also pledged to deliver massive support for the ruling All Progressives Congress in the 2027 general elections. President Bola Tinubu has called for state governors to work with the federal government to reconsider the issue of state police as an additional safety buffer for improved security in the country. The president was speaking when he received the 6 governors from the Northeast, led by the Borno State Governor, Professor Babagana Zulum. The president assured them that his administration will continue to work with the subnationals to develop the economy. President Bola Tinubu has directed the Secretary to the Government of the Federation to issue a service-wide circular to all ministries, extra-ministerial departments and agencies on the implementation of the mandatory health insurance in line with the National Health Insurance Act 2022. President Tinubu also called for further, closer and constructive engagement with the private sector on the act to ensure that businesses are not unduly constrained. According to the statement signed by the Special Advisor on Information and Strategy, Bayo Nanuga, the President's directive covers 5 key areas. First, all MDAs must enroll their employees in the National Health Insurance Authority (NHIA) Health Insurance Plan. All entities participating in public procurement must present a valid NHIA-issued health insurance certificate as part of their eligibility documentation. This certificate confirms compliance with the mandatory health insurance requirement and serves as a condition precedent for continuing any procurement-related engagement. Vice President Kashim Shettima says the visit of the Colombian Vice President, Francia Marquez, to Nigeria will serve as a gateway to a new chapter for both countries. Vice President Shettima stated this during a gala dinner in honor of the Colombian Vice President held at the banquet hall of the State House, Abuja. According to him, the visit is proof that Nigeria and Colombia are about to enter an era of fraternal union that would create deeper political cooperation, bolder economic ventures, and richer people-to-people exchanges. He conveyed the goodwill of President Bola Tinubu and Nigerians to the visitors, maintaining that what has brought both nations to bilateral agreements is a shared interest in the destiny of the two countries. President Bola Tinubu has left Abuja to commence a working vacation in Europe as part of his 2025 annual leave. He was seen off at the Nnamdi Azikiwe Airport by the Secretary to the Government of the Federation, George Akume, the Chief of Staff to the President, Femi Gbajabiamila, Imo State Governor Hope Uzodinma, Lagos State Governor Babajide Sanwo-Olu, the Minister of Finance and Coordinating Minister of the Economy, Wale Edun, the Minister of Budget and Economic Planning, Abubakar Atiku Bagudu, and others. According to a short statement signed by the Special Advisor to the President on Information and Strategy, Bayo Nanuga, the vacation will last 10 working days. The President is to spend the period between France and the UK and then return to the country.
Welcome back. Tonight, we have a sit-down with Dr. Adedolapo Fashawe, Mandate Secretary of Health Services and Environment in the Federal Capital Territory Administration. Have the promised MRI and CT scan machines been delivered to health centers in the FCT? How is the health sector faring under her watch? And what are the challenges with turning around this negative perception of healthcare affordability and access in Abuja? Please watch this. Fashawe, welcome to Dateline Abuja.
Thank you very much. I'm honored to be here.
I mean, it's interesting, you know, recently we've been hearing a lot from people who work in this administration, and that's something that the FCT residents have been clamoring for. We've wanted to be able to hear, especially from mandate secretaries. We're still trying to make our way into the area council chairman, but to hear mandate secretaries talk about what it is that they do, particularly your department, which is health.
First of all, there's infrastructural growth, and there's also systems growth. When we talk about health, health is a system. It's not just a program or a project. It's a system and a way of life. And we approach interventions in a scientific manner. For example, the minister has been doing a lot of infrastructure in roads, connecting the city, the municipal area, into the hard-to-reach areas, into the satellite cities. In health, there's something called accessibility. There are things that affect mortality. Let's say, for example, pregnant woman. What are the things that affect her chances of having a live baby? Accessibility to a referral hospital. This was, if we say we were coming from a scale of 0 to 10, we were on 3. Now we're on almost 8. There are artery roads leading from every community into general hospitals. To the normal eye, it may not look like we're doing anything in health. But once we have created the accessibility, it is easier for our ambulance to do 7 runs in an hour because the roads are clear, the lights are on, the state is more secure. In terms of the systems too, we start to look at our doctors being remunerated, our doctors passing exams, our resident doctors. What are our indices in immunization coverage? I'm happy to say that, well, I'm not happy, but growth is something that excites one. 3 years ago, we had 25% coverage. Now, the last national data vault that was opened showed that FCT was leading in skilled birth attendants by 102%. And if we have 102% women giving birth at a skilled birth attendant place, That means 102%, 102% babies are receiving immunizations. So it's a ricochet effect. It is not acceptable. This administration has zero tolerance for maternal mortality. So I'll focus on that. The minister will not go and build mother and child centers, for example, and say we want to tackle maternal mortality. When our people believe that giving birth in a traditional birth attendant home is the only way, when our people believe that if you have your baby by cesarean section, it is an abomination, when our people believe that they're just saying they will give us free health insurance, it's a lie. When we get to the hospital, we will pay a lot of money. Why am I building hospital? Even worse, there's the Japa syndrome. We do not have there's practically an emergency in human resource for health. The city is growing. The health demands are higher, but doctors are not coming here. Rate of living is high. Remuneration. I am happy to say the government is working on adequately remunerating doctors, but honestly, it is difficult to put a figure to someone's passion to save a life. Because to save a life, if someone fainted in the studio now and we all had to empty our pockets to save his life, I'm sure nobody will think twice. That is what a doctor does every day. And we are doing it actively in Abuja. And we do hope that this will translate to verifiable indices, figures, and we'll be able very soon to call Abuja the hub or the capital city of healthcare. Yes, we are now working on infrastructure, but things are done in stages.
I mean, I was going to talk about the remuneration bit for doctors, because that's been in the news, hasn't it? Doctors and nurses of the FCT asking for better remuneration, threatening to go on strike from time to time. What's the Mandate Secretary Office, in collaboration with the minister, what's the plan for the doctors in this Abuja?
It would amaze you. The budget is a public document. For 2024, it was planned to employ 982 healthcare workers and also pay all arrears. And I am happy to say in 2024, accruitment arrears allowance, uniform allowance, was paid for the first time in about 8 years. The allowances of those, there are some minor administrative issues, and this is not unexpected. FCT was under the Treasury single account. They were being monitored, financed, accounted for. Human resource was under the federal government. Now, technically, we have a civil service commission that is separate from the federal government. There are teething works in transferring federal doctors separate from state doctors, in picking up salaries, in picking up all the areas that the doctors are asking for. About 60% of them is they have paid some, they have not paid some. They have paid some that started work in 2023. They have not paid those that started in 2022. I believe these are teething administration problems, and the doctors are aware that the minister is working hard on this. He has been able to avert a strike once, and he's very open to conversation. And I do believe that there's no situation that we cannot sit down and negotiate and talk when it comes to remuneration. I want to use this opportunity to give a big thumbs up to the doctors in this city, in FCT. They do give a lot, in spite of how difficult it may seem right now. And I believe that they see the star at the end of the channel with the minister. The minister has a lot of plans for the health sector. Dealing with health means it will do things you people can see, but it doesn't mean he's ignoring health. We are winning awards in immunization coverage. We are winning awards in antenatal care attendance. We are winning awards in different competitions within the 36 states. And this can only happen if Mr. Wike is supporting the health systems. It's not where we want it to be, definitely. Far from it, but we're working towards it.
All right, we do have to go on a short break, but before we do, my condolences to you and to every mandate secretary, and indeed everyone in the FCTA, mourning the death of the head of service for the FCT. I mean, that was a tragic loss, and our prayers are with all of you, and we know that you're all mourning right now. But we'll go on that break. When we come back, we'll take a look at some of the plans that are already in motion. Like we started this interview with me telling you about the fact that the FCT minister said MRIs and CT scans were going to be purchased and going to be sent to the hospitals. So now we're going to be looking at the quality of healthcare in the FCT. And we'll talk about that when we come back from this break. Please stay with us on Dateline Abuja. We'll be right back. Welcome back to Dateline Abuja. If you've just joined us, Dr. Adedolakpo Fashawe is with us, the Mandate Secretary on Health for the FCT. Thank you again for making out the time to be with us. All right, you talked about access and how infrastructure helps access, and then welfare of our doctors and the plans for all of them. Let's talk about the quality of the healthcare in the FCT, especially when it comes to primary healthcare centers, or even secondary and tertiary. Where would you rate the quality of healthcare that we're receiving right now? Especially, I'm not talking about private hospitals, I'm talking about government hospitals for the people at the grassroots. What kind of healthcare is being made available for them, and what's the plan to upscale it?
Thank you very much. Abuja is a very interesting topography in terms of health-seeking habits. I had to take time to study the knowledge, attitude, and practices of the people. We follow tradition a lot. And to break that takes a different approach. What this administration has done to improve healthcare delivery is change mindsets, use community settings. We now use religious fathers, we use market leaders, we use political leaders, we use the chiefdoms, we use the emirs to preach a message that come to the hospital, there's health care. I must agree with you that they didn't just stop coming. They stopped coming because they were not receiving what they were meant to receive, quality health care. And this had happened
over the years.
And they had found ways out of it, which was okay for them. Now, this administration has come in, and we are determined to give quality health care. Yes, the minister announced it, that a CT scan and an MRI are in the process of being procured for the FCT. This is true. Procurement process takes a long time for us to do it right and get the right technical specifications, and also know that this MRI and CT scan is sustainable. It can take care of itself. We have human resource that can operate it. We have energy, renewable energy, light that can back it up. We will not invest hundreds of millions of naira into a machine and an electrical surge or a bad batch of electricity just booms it.
FCT residents have had to turn to traditional ways of curing one thing or the other. Even things like cancer, we have people who are medicine men in Abuja who say they can cure all kinds of things. In fact, there was a time when the pangolin market was we had to do programs to protect the pangolins in the FCT because people were killing these animals and using them for all kinds of medicinal purposes. And the reason was two things. Access to quality healthcare was almost non-existent. And then secondly, when you do get quality healthcare, it's too expensive. You have to sell your land, you have to sell your properties to be able to access proper quality healthcare. What are the plans to change that?
I am very happy to talk about quality. When we came in, the Presidential Task Force on giving people key performance indicators, the administration of President Bola Ahmed Tinubu of the Renewed Hope is very serious about data. And it's amazing to me what this data will do for this nation when we start to use data to make policies. So now, every single MDA, ministry, department, or agency has a performance indicator and milestones that we tick along the line. There's a committee in the President's office that is responsible for this. And what they gave us in FCT health sector was increase the number of people on health insurance by 1,000 a year in the next 4 years, and also build more primary healthcare centers. So at 1,000 a year, I am happy to say that we're in our second and a half, third year, and we have increased by 328,000 people. And why are more people coming to the health insurance scheme? We deliver. Before now, you'll be a health insurance patient, and once you see the doctor, they give you a piece of paper with prescription, go and buy. No, we're on electronic medical records. And once you're a health insurance patient, all the medication written for you must be administered. If it is not available in the hospital, there's something called emergency purchase. And with insurance, I think it's word of mouth that spreads this. Every general hospital, subnational, states that conducts a cesarean section, the federal government refunds that hospital for every money it has spent on cesarean section.
So I said the passenger. So the patient doesn't have to pay anything.
The insurance will pay.
Okay, so if you're insured, you come with your insurance
yes.
paper.
However,
yes,
insurance is 27,000 per annum.
Okay.
To do a cesarean section costs much more than that. We know how insurance is. Now, I have a key population in Abuja, pregnant women. So we spend a lot of money on insurance. If it's CS, the federal government will refund me, not the extra money I have spent, the whole money I have spent on health insurance if that patient is registered on health insurance. There's a lot to be seen. But if we fail to plan, we plan to fail.
Yeah.
We're in planning stages, and we will be back here to show you impactful, tangible, and exciting results.
Thank you so much, Dr. Adedola Fashawe, for being with us on Dateline Abuja. Good luck with all the work you have ahead of you. And we'll be checking up on your office from time to time.
I need it.
I know. It'll be okay. Thanks to my guest and to everyone who spoke to us today on the program. Please let us know the happenings in your neighborhood using the social media handles showing right now on your screens. Thank you so much for watching. I'm Kayla Magwa. See you next time.